Singapore is home to hundreds of thousands of migrant workers. From July, help in a crisis will be just a phone call away. The Samaritans of Singapore and HealthServe are setting up the country's first 24-hour crisis hotline for migrant workers. Both groups already offer counselling and are reporting more serious cases of suicide and anxiety, even as the number of calls comes down.
Migrant worker charity HealthServe gets about 2,000 calls through its counselling helpline each month. That's down from a high of 5,000 during the peak of the pandemic in the middle of last year. But they're also dealing with trickier cases.
We need to provide interventions for suicide attempts or self-harm or even anxiety disorder. The current counselling hotline is actually based on referrals and assessment. The difference between the 24/7 crisis support hotline is that we are able to provide de-escalation on the spot and to provide the care and help required immediately.
Last year, at least 4 unnatural deaths among migrant workers were reported, raising concerns over their mental health. Personnel will be trained to handle pleas for help into the wee hours when calls are expected to pick up, complementing the current counselling hotline that operates during office hours. HealthServe inked a partnership with Suicide Prevention Centre (SOS) to train about 20 staff and 120 volunteers. It will customise a training curriculum covering skills like active listening, empathy, and how to intervene in a crisis. The hotline will take calls in English and Tamil at the start before expanding to include other languages like Bengali.
SOS in the past year, we do receive call from migrant workers, but very little, only average about 2 per month. They have limitation in speaking in English. We have to refer them to HealthServe. This partnership is ideal for them to be able to reach out to this community directly, provide a seamless support.
Training will begin next month.